to the cloud. Okay, hi everybody. So this is Pam. She will be presenting the Hurst review today for OhSNA. If you guys have any questions, I will be monitoring the chat box. Please also put where you go and when you graduate so Pam has an idea of like where we're all at in the program. Okay, go ahead, Pam.
Thank you, Marissa and the Ohio board. I'm sorry that you guys couldn't have the virtual convention, but things are so crazy right now. I totally understand. But I am super excited when I was asked to be able to present to you a little bit of what we were going to talk about at the virtual conference, not the whole thing, of course, but just a short introduction to Hurst Review, because I think a lot of you may not be familiar with Hurst. So I am brand new to Ohio, so I wanted to get to know some of you a little better and figure out where you're going to school. And I live in Mississippi, in case you can't tell. I don't live in Ohio, but I'm hoping to get to travel up there this fall and meet some of you guys and go to some of your schools. So awesome. Thank you for coming and joining us today. I know for some of you, NCLEX is, I don't want to say imminent, but it's like very close, right? And some of you, it might be a little ways off, but it's never too early to really start thinking about NCLEX and how to prepare. Because nursing school is hard. It's hard to get in nursing school and through nursing school. And then you have this big test hanging out there at the end. So that is what our company at Hurst Review is all about. It's helping students pass the NCLEX and not only pass a test, but be able to successfully transition from that education to clinical practice piece and feel confident on day one that you can practice safely, because that's really what the NCLEX is all about. So just a little bit about me. I am a nurse. I'm very proud to be a nurse for 29 years. And I have a bachelor's and a master's from UMC in Jackson, Mississippi, and I still live here really closely. So I've done a lot of things in nursing, and that's one of the great things about nursing is it's so versatile, right? You can do so many different things, different roles, and if you get bored, just go get another job, right? And right now, especially, I'm sure it's the same in Ohio as it is in Mississippi. We need nurses right now. We really need you guys. And I think it's so brave of people to go through nursing school and come into nursing during a pandemic at a time that's just, we really need you. And I'm so proud of all of you. So congratulations for those of you who have already graduated or getting really close to graduating, and hang in there for the rest of you, right? So my job is to let you know what Hurst Review is all about, right? What we do, how we do things, and then give you some NCLEX tips along the way. So I'm going to share my screen now. And Marissa, you let me know if you can or can't see me, or somebody could maybe give me a thumbs up in the chat. And I'm not sure I'm going to be able to see the chat once I get this screen up. So just let me know if you can see like a QR code.
We can see it.
Yes.
Awesome. Awesome. So all this is for registration. So we had 22 of you guys, and I'm assuming that's who's on here. But just in case you joined the Zoom, but you're like, oh, I didn't get in on the registration part, this is where I'm going to do the drawing from. So I'll give you a second to scan the code and get entered if you would choose to. So what we're going to do is I'm going to draw for a $25 gift card from the students registered. And I'll just choose that from a random number generator to be super fair on my phone. I will email the winner either later today or this weekend because it's Friday. But I promise you, I will let you know the winner. And I'll just, like I said, do it randomly. And then you can choose either Amazon or Starbucks. So this is for a $25 gift card to Amazon or Starbucks. You also do get entered into our Hurst system. So you will be notified if we run specials, or they may send out a sample question from time to time. So that's what that is all about. And if you guys need it, it's on the link that was sent to you. It's still going to be up on the website, I'm thinking, for a little bit longer. So you can get it there. All of you who are registered, I just sent an email earlier with a Zoom link. So my contact is in there as well. And I know Marissa will make it available. So if you have any questions for me after today, if you think of something, or if you would like a visit to your school or anything that I can do to help you guys, my cell number's on there by email. So just text, call, email, any way you need to get for. So we all want to pass the first time, right? Of course we do. There's lots of reasons for that, but not only do we need you in nursing, but you guys have invested a lot. You're tired and you're ready to be done with this. So I just want you to know that that is our job at Hurst. It always has been. is to help students pass the first time. And the reason that I'm so confident Hurst can help you is because of our pass rate and our experience with students. 9 out of 10 of our students recommend Hurst to their friends. So maybe you know somebody who's taken Hurst Review and they've mentioned it to you. I'm not really sure how well known we are there. So if you've heard of Hurst or had a friend or somebody tell you about it, you can put that in the chat. Just let me know. That'd be great. We have an excellent first-time pass rate of over 98%. If, okay, there's just an asterisk beside that 98%. If you finish the review in its entirety, right? Like anything else in life, you got to finish it, and test within 3 months of graduation. So for students, it's their first time testing and they finish the review. We check those students and make sure as far as there's a money back guarantee. So if they don't pass, they have every incentive to let us know. And based on that, we've got an excellent pass rate. So it works, you guys, bottom line. That's why students recommend us to other students, is it works and it's fun. And we've been doing this a really long time, over 30 years working with NCLEX. So be confident that we're going to give you what you need for this test. So let's talk about the test for just a second. Why do we even do NCLEX? I mean, you guys went to a really hard nursing program, right? You made good grades, you graduate, you survive. And then why is this one huge test out there? In one word, the answer, if you guys have answers, you're welcome to unmute yourself and just shout out answers or type them in. And I can't see the chat. So Marissa, you tell me if anybody has a question or anything. But this is a safety test designed to protect the public from unsafe nurses. And that's just a little twist on the tests you took in nursing school, right? They were all hard. They were all on lots of content, lots of things, but they have to make sure that you know the information. They teach you clinical judgment, model that for you in clinical, and then you have to take all of that vast amount of knowledge to the NCLEX and prove to them that you can apply that knowledge in a safe way to take care of the client that is on the screen in front of you, right? That is what NCLEX does. So it protects us when we're in the hospital, our family, the members that we can't always be there, especially now. So we want to be sure that those nurses taking care of them are safe, minimally safe and confident. And that's what the NCLEX does. It protects the public. So saying all that to say, it is a little different mindset when you go into NCLEX. We call it at Hurst Review thinking NCLEX-y, right? There's just a certain way you have to think about this test, and it is always thinking with safety in mind. So one of our strategies is safety first, always assume the worst. Do not let the NCLEX fool you with a question like, your client has mild neck pressure, right? Or a small amount of bright red blood. Okay, if I'm a brand new nurse, I've just started in practice, and I say mild neck pressure when my client has had, let's say, a thyroidectomy, I'm thinking the worst. I'm thinking their airway is about to close up. This is how you think for NCLEX, and it's how you keep people safe, and that's what they're looking for. And you're going to get lots of practice all throughout the Hurst Review if you choose to take that. So what do you get with Hurst? Why Hurst, right? Well, first of all, why do you even need a review? Okay, we talked about why NCLEX, but why a review? Because you're probably looking at these topics and saying to yourself, you know, we covered that. We had a lecture on that. We had a test on that. We know that. Here's why, a couple reasons in my opinion. I would not have considered taking the NCLEX without a review course, and I was a good student, right? I know a lot of you are, because you have covered so much information in such a small amount of time that you need to review it, right? You review for every other test you take in nursing school. Why would you not review for the biggest test of your career, right? So if you may have had a lecture way back in fundamentals on something that we're going to remind you about in the Hurst Review that is pertinent to NCLEX, because basic care and comfort is one of the areas on the NCLEX, and it's one that students don't always do so well in. Could be because it's been a long time since you covered fundamentals, but that is so important. Everything on here is important. Now, can you possibly know everything? Right? Can you know everything they're going to ask you? No, nobody can know everything. Nobody knows everything. And if they think they do, they are dangerous, right? And especially us with our 2 weeks of nursing practice, when we get out there and we're going to be a little scared, right? Don't you think? that is going to keep you on your toes and help make you a safe nurse. I'm a little worried about the students who aren't a little scared, right? So let me take this time to address the PNs, the LPNs in here. We've got some people in this group who have been practicing, right? You're like, we already did NCLEX and we've been practicing for 10 years or 5 years or 20 years or whatever. Maybe you've got some Army medics or EMTs, whatever. Let me just say this to you. The NCLEX is for brand new nurses, right? Brand new nurses with very little experience. So in some cases, it's a little more difficult, and you may have found this even in nursing school, to answer some of the questions the way they want you to answer because of your great experience, right? I imagine some of you are nodding with me because we hear this all the time. So your experience is amazing and it's going to really, really help you in practice, right? But we have to get through the NCLEX first because they don't assume you have that experience. They're testing everybody the same regardless of their background for this NCLEX RN. So just trust us when we tell you how to think like a brand new nurse. Now, when you went through some of these topics at school, y'all probably took notes, didn't you? Right? Like you have a lecture, you take some notes, you study really hard, you take a test. Did any of you memorize things for the test, right? Me, I had a baby in nursing school, 8.5 months old when I started. He's 31 now. That's another story, but it was tough, right? It's hard. A lot of you have children and families and jobs and lives. Some of you may be in the military, but you've got a lot going on. And I know sometimes you have to just do what you have to do to get through the test. But did you think in your mind, I'm going to save these notes and one day I'm going to go back and review that because I really need to understand that concept a little better, right? Great strategy. But have you had time to go back and study anything? I'm sure you kept all your notes. They're highlighted, color-coded with the little pink tabs, right, sticking out on the side, rubber bands around all those notes or on your computer files. But you just have not had time to go back. I know because nursing school is so busy. Life is so busy. Guys, that's what we're going to do for you. That would be overwhelming anyway to think you had to go back through all of your nursing school notes, wouldn't it? Also, what would be overwhelming if somebody said, just review this resource, right? This 600-page book, just know this, and you'll be fine for NCLEX, right? You guys, y'all have still real books. This is my med-surg book. It's like super heavy, as you guys know. That's overwhelming and not reasonable. And, let's be honest, did we read all of the assigned chapters even when they were assigned? Maybe not. Some of you might. But here's what I'm going to tell you about Hurst Review next. So we're going to go back in a second and cover what you get before the review. But during the review, if you do it at home or in a live review, you're going to get a workbook. You see how big this is? Smallish, right? About an inch thick or even less. Usually students look at this and they think, okay, that's manageable. I can do that, right? As we teach the information in the review, whether it's live or live streaming or online, you're going to be following along in your workbook, filling in the blanks. So you're writing as we're teaching, we're going to make sure everything gets filled out for you. And then this will be your study guide, this and your online resources. So that's manageable because I know you've got tons of books, you've got tons of questions, you've got all kinds of study material, and it is overwhelming to decide where to focus your study. So we really think it's important to focus in on mastering a certain amount of content to go into that NCLEX feeling like you're well prepared. And you're going to get that with Hurst Review. If you take the review at home, online, live streaming, we mail you the workbook. And if you take a live review, then our instructor will bring those workbooks the very first day of the review and hand those out. By the way, I used to teach this review and absolutely loved it. It's so much fun. So if you decide you are interested, you're going to enjoy it. So our testing strategies, I touched on a little bit of this earlier, but testing strategies for NCLEX are a little bit different than maybe some other testing strategies. Let's say you've taken ACT or SAT, right? And you learn some strategies like if you're running out of time, just start, click, and see, right? Y'all remember that? Or do not do that on the NCLEX. Do not do that on the NCLEX, right? Or look for the longest answer. This is not those kind of strategies. These are strategies that only make sense for the NCLEX, and they're things like I told you before. Think safety, assume the worst in every question. It wouldn't be a question on the NCLEX if there wasn't something for you to worry about. So you worry about every client in every question. We're going to give you all sorts of tips like that. So that's worked all throughout the review and in our videos. And then every now and then in the review, we're going to give you a critical thinking exercise. We're just going to say, stop for a minute. And here's the scenario. And what would you do? What would you intervene with? Which client would you go see first? What do you think to expect? And we're going to have you talk that out with your classmates if you're in a classroom setting, or talk it out to yourself if you're at home, because we know that saying things out loud, it's a better way of learning than just reading your notes, right? So just go with us on this. But we're going to walk you through those. And you know what? These are going to be challenging in a lot of cases, and you're going to miss some of our questions that we have at Hurst Review. Now, how do I know that? Because if our students didn't miss questions, we wouldn't have the right questions to challenge you with. Because NCLEX is going to challenge you, right? And wouldn't we rather miss a test in the review than at the testing center, miss a question rather in the review than at the testing center? Absolutely. And you know that you always learn from the ones you miss. You just tend to remember those better, right? So learn from the ones you miss. This is whether you're going through questions and answering them in an app or whatever you're doing, or whether you're in the review. So nobody makes a 100 on the NCLEX, right? We're not trying for that. We give up on that a long time ago, maybe with the hand washing check off. I don't know. We're just trying to get out of here, pass, get our license, and go on with our life, right? So trust the process, and we're going to make it fun for you. One other thing that I think makes Hurst Review stand out from other review courses is that we try to have fun. We use humor and storytelling a lot, because if you hear something in the form of a story, it just tends to stick with you better than a fact, right? There's some things we just have to tell facts about. But if there's a story, and we're going to have some silly ones, and you're going to think, oh, that would never happen, but you're going to really remember the concept from it. And it makes the day go by faster. And if you're laughing and having fun, well, who doesn't like that, right? So that's what you get with Hurst Review. Now, even before you take the review, let's just say, for instance, let's say we schedule a review in December in Columbus or whatever. January, whenever you guys graduate. 3 days review for RNs. It's live from 8 to 4:30 or 9 to 5:30. We're adjustable, so any way that you guys would like it. We just need a minimum of 25 students to have a live review and send a live instructor in a classroom setting. So if you want to do that, great. Just reach out to me and let me know. Or if your school would like to be interested in having one for your class, certainly let me know. But let's say you decide to take an online review or live streaming, but you're going to do that in December. So if you register today with $50 deposit, you would immediately get access to the 1,500 NCLEX practice questions. So that's included immediately when you register before your review. Also, you get a resource library. Now, back to the 1,500. You do not have to answer all 1,500 questions. So earlier when I said finish the review, that's not included. That's optional, and so is the resource library. That is just amazing documents that are handy for your resources. They are meds by body system, so it's got pharmacology summarized there, all types of infection control and types of shock and immunizations, growth and development, just a conglomerate of awesome information, because we can't cover everything in a 3-day review, right? So even with everything you've had in nursing school, whatever review course you take, whatever book you read, you could still get a question, and most likely will, on the NCLEX that you have never heard of before, right? You've been told this, I'm sure. So don't let that panic you, right? Just answer to the best of your knowledge, break that word down, figure it out with the context, use the strategies you learned in Hurst Review, answer it, and go on to the next question. We're not going to stress about that because we're not trying to make a 100. So again, before the review, you get all these great questions that you can make a quiz any way you choose, and those resource documents, if you want to read them, they're there. It's all outlined for you. During the 3 days of the review, we're going to review that core content. By the way, we chose that core content topics there that you see based on our years of experience with what we know you have to have nailed down for NCLEX. We can't know everything. We've established that. But there is a certain amount of information that you need to know it perfectly, and you need to be able to have immediate recall of that information in the review, at the NCLEX rather, and that's what we cover in the live review. We call it core content, must know core content. Then we're going to go through your workbook, you're going to fill in the blanks, cover those testing strategies, and then after the review, if you take a live or live streaming, you're going to have 9 months access, which is crazy long, way more than you need, right? Because you're going to test within 3 months of graduation. But you're going to have all this access. So don't worry that you won't have enough. In the very back of this book, there's specialty lectures, maternity, peds, management delegation, neuro. We cover some of those topics in the review, but you've got whole sections there. You watch those on your own, fill in your book. You have 9 months of access to those videos, which is about 5 hours of video. Then you've got study time, of course, study your book, review anything. And then you've got 4 practice NCLEX style tests that we call Q review tests. So just for a quick minute, do we have any questions, Marissa? I'm going to pause for just a second before I talk about our practice test. Any questions? I know I'm talking fast, but it's Friday afternoon and I want to not keep you guys any longer. I see a hand raised. Zane, is that a hand raised?
Yes, I have a question. So how soon would you say a person should start like review for NCLEX? I am doing an accelerated program and I just started this past August and I'll be done in December of next year. So do you think I should start it now or should I wait until I get later in the program?
So you graduate December 2022, correct?
Yes. Yes.
I think now is too soon. It's not too soon to start thinking about NCLEX, but you have a lot of content to cover between now and then. Focus on getting through what your school program has for you to do. And then I think personally, going into that last semester is when you really, really hone in on NCLEX prep, right? Because you've had most all of your med surg, and then you're going to start reviewing and prepping for NCLEX. So let's touch base closer to time. What school do you go to, Zane?
I'm at Ursuline College.
Okay. And I didn't even know about that one until you guys registered. I'm so glad y'all are here. Where are you in Ohio?
The school is located in Pepper Pike, Ohio.
Okay, cool. Well, I'd love to reach out to the faculty there, but yeah, that's what I would suggest. Touch base closer to time. Again, never too soon to start thinking about it, but because the way that you answer NCLEX questions, there's that little mindset twist on it. You need to learn everything first, and then we're going to review what you've learned, but everything we review is with a bent toward how the NCLEX wants you to apply. Does that make sense?
Yes.
So just wait closer. Another question, McKenna?
Yeah, so I'm also in the accelerated program. I'm graduating this December. So yay. I actually just accepted my position today and I'm really excited, but thank you. So I'm like kind of in the same boat, not necessarily like in timing, but like I'm trying to figure out kind of like which way is the best way to go with terms of figuring out like where to study from, I guess, because you hear so many different things and like so many success stories from so many different areas, and it's kind of hard to like hone in, I guess, on what one to go for. And like I was just gonna say, like, just to bounce off of you, like I was like kind of like the girl who just asked the last question. I was like wanting to start preparing like a year ago. But like, I'm happy I definitely waited just until now. I'm about to start practicum. I'm in my last semester. And, you know, I feel like now I can go in and actually study and really understand the material that I'm like, you know, going after, you know?
Yes, thank you for that feedback. That's exactly my opinion, because you just have to get through school, first of all, and there's just so much to learn. And in those accelerated programs, you guys have an even shorter time to learn all of it. So I think that's crazy fast that you learn things. So I agree. Do you go to Ursuline as well?
Yeah, I think we all do, if I'm not mistaken, maybe not, but I know there's a few people in here that do go and are in that accelerated program. So yeah, it's a 15-month BSN program, which is kind of, it's a lot.
Yeah, it is. It is. So let me ask you this. Do you guys have a review that is scheduled at your school or a resource that you're using already?
We have in December, I think, or maybe at the end of November. I don't know the exact dates, but we have like a 2-week live session. I'm not sure who it's with. We haven't really gotten any any intel about like any information, if you will. I just know it's on our like tentative schedule. So I don't know if it's like with Hurst or if it's with like whoever, but I do know that we do have 2 weeks scheduled.
So it's not with Hurst, because I would know and I would have set it up. And probably if it's 2 weeks, just total guess, I'm guessing it's something maybe your faculty is doing for you.
Maybe.
Probably to get you prepared. So if your class, and how many are in your group?
We have like I think we have around 38, maybe 40.
Okay.
I think
So
46.
a lot of, okay, no problem. A lot of people use the resources their school gives them, and I absolutely 100% invest yourself in what your school has provided, all of you, whatever program that is, because they've done a lot of research and they've chosen what they feel like you need. Sometimes students will choose to do an additional resource in addition to what their school provides. So if you guys choose to do that, then I would suggest maybe scheduling a review after you graduate, because we don't ever want to interfere with graduation or exam dates. And I always check with faculty, always, to make sure that dates line up and we're not conflicting with anything. And then if you're interested, you could set up a review and go there. I would encourage you to check out our website, check out what people are saying on Facebook. And like I said, we're just not as well known in Ohio, I don't think, as we are in other locations. But I am happy one-on-one to answer any questions for you. Personally, I think it's the best option, and I think it's a great complement to whatever program you do in school.
Thank
And I
you
see
so
a hand
much.
raised from Marissa, maybe.
I just wanted to give like a little helpful spiel. So I go to Chamberlain and I graduate in December as well, and it's an advanced accelerated program. We also signed up for the 2-day NCLEX live review. That is something that the schools didn't have to go out of their way to do. It's kind of just provided to everybody who takes the NCLEX. So like what Hurst is doing and Pam is doing is it's an extra thing to help push your grade higher. Like my school just scheduled with them for us to do something in October. So we'll be able to get all the review materials that she's talking about and everything like that. And your school is capable of doing that as well. You just need to talk to the right people. I would say talk to your professor, or if you have an advisor, mention it to them, and you can always give them Pam's information, and maybe they could
Yes.
provide something like that for you guys as well, like my school has.
Thank you, Marissa, for clarifying. Yeah, we do. In some cases, the school would provide Hurst for students, and that's what's happening. That's what she's talking about. But for everybody else, that's not going to happen, to my knowledge, and probably is a little too late to make that happen right now. But what I would love to do is be able to meet with your faculty, again, because I am new, and just let them know about it, because it may be something they want to think about in the future. And even if not in the program, it's great for them to know about it. So if you guys go to them with questions, they at least know what Hurst Review offers, and can advise you, because they know you a lot better than I do, for sure. Any other questions? I'm going to just cover the test and a couple more tips. I do want to give you the discount code. So for live review, which again, we do not have live reviews right now scheduled in Ohio. I don't just like go and schedule them. I want to make sure with you guys, if there's interest in your area, we can work it out. We are willing to go anywhere that we have enough students. But right now we don't have any. But if you want to take live online, and you can start that in your last semester, if you're like, what, I'm an online learner, I want to just dig in there and start a little early, you can do the Hurst Now, which is our complete online, or you could do live streaming. Now, live streaming is where this code will work. Live streaming or live, $50 discount, because our regular price is $3.99, but just as a special for the board, I'm giving you guys a $50 discount. Now, that's good for 2 weeks, but I know that some of you graduate beyond that. So please contact me and we can work something out for the discount code going forward. So I don't want you to think it ends in 2 weeks. They just asked us to put a limit on how long it is, but I'm willing to work with you guys on that. So let me, there was my contact information too. Marissa, do you mind typing it in the chat? My email, and so, do you mind? And also, everybody pre-register, you got an email with it on there. I'm about to stop sharing my screen, and I have a couple chats. Questions? And for the Rio Grande students, it would be great to reach out to Bonnie Smith. Actually, I have been in touch with Dr. Smith. And I'm hoping to get to meet with her this fall. So thank you for that. She's been wonderful to work with. Perfect. And she probably is the one who sent you this yesterday. I think I sent her a reminder. Great. Okay. Let's talk about the test for a second for NCLEX. For those of you guys who are close to NCLEX, how many questions do you have to take minimum? You guys know?
Is it 75?
75, exactly. How many of those actually count toward your grade? toward whether you pass or not. 60, not a trick question. There are 15 pilot questions. So out of the 75, 60 count, but you do not know which 60, right? So for you, it's just 75 minimum. Now, what is the maximum? Anybody know?
Is it like 200 or 150?
So it changed. So you're close on both counts. It used to be before COVID, 265. Okay. Now, if you graduate 2023 or later, I don't think any of you are in here, but if you do, that's next generation NCLEX. That's a whole different topic. But if you're graduating before then, 145. So, and only 130 of those count, right? Remember the 15 questions. So what does that say to you? That COVID has shortened the test length. So you have over 100, about 120 fewer questions now to prove that you're a safe nurse to the NCLEX. Not to panic anybody, not to stress you out, but to emphasize the fact that you need to go in there prepared, right? Go in there knowing your content really well, knowing what to expect, because that's what it is. Now, our practice tests are 125 in length, and that is because that is the average pre-COVID. So you're going to get practice with long tests that are close to the length or even longer than maybe you will take on your NCLEX. They're divided according to the client need categories, so you can use them. Their rationales for every answer, correct and incorrect. So great learning tool for when you finish to see where you are and make sure you're ready for NCLEX. So that's what our tests cover. Let me ask you this. Do you guys have friends who took NCLEX and maybe you talked to them right when they left the testing center, right? They tested, they left, they texted you. Like, what was their state of mind? Anybody have friends who tested and talked to you right after?
A lot of my friends said they cried.
They cried. Oh, that makes me sad. But they passed, didn't they?
Yeah, but they just said it was super stressful.
Most of your friends passed, but they didn't feel like they passed at the time, correct? Why am I telling you this? Because I think knowing what to expect is a great way to reduce anxiety. You're going to be anxious. You're human. It's a high stakes test. That's just the way it is. But I think the two things that decrease anxiety, the two things that cause increased anxiety, so you can help to prevent them, is going in there unprepared, not knowing your stuff, not studying enough. And you guys know that feeling when you go in to take a test in school and you're like, you know what, I did everything I could do, bring it on. There's nothing else I could have done, right? Versus, probably shouldn't have watched that Netflix. Honestly, I probably should have studied more. You guys know that feeling, and don't go into NCLEX with that, right? Go in there like, I've done everything. I know this book inside and out, whatever resource you choose, and I'm ready, okay? That's the first thing. Knowledge deficit is why people are more anxious a lot of times. Secondly is not knowing what to expect. So that's one reason I like doing these calls, because on the NCLEX, you want to go in there knowing what to expect. So here's a tip. Watch the tutorial that is on the the NCLEX website. That's the day of and what to expect. Read that, because they're going to take your cell phone and put it in a Ziploc, and I don't know what all they do, right? Palm prints, things like that. So if you know everything that's going to happen when you walk in there, you're not as anxious, right? You're prepared. Take as few things as you can, go in there prepared. And if you kind of prepare yourself mentally, mindset wise about this test, because what are you going to do when you answer question 75 and then you hit enter and a new question pops up, the dreaded question 76? What are you going to do? Don't freak out. I don't even know. Yeah, do not freak out, because that's our normal reaction, is to want to panic or freak out. Okay. Really important not to freak out, because I know everybody wants it to turn off at 75 and all your friends did. I know. But a lot of people take more questions than that. And here's the key. Every question that you get after 75, you're still passing. So you need to do a little self-talk, right? Say, every question I get from now on, I'm doing something right. Don't speed up. Just keep going at the same pace. Answer every question like I've been doing. I'm doing fine. That lady at Hurst said that I'm doing fine, or I wouldn't be getting any questions. So just keep yourself calm, right? You guys have learned coping mechanisms in nursing school. You're still here, so I know you have. And deep breathing is the one that's feasible for use at the testing center, right? Some are not. But just stop and take you a really deep breath at that question, reset your mind, just do some self-talk, but go in there again, prepared mentally to take 145 questions. Just set your expectations for that. So anything less, you feel like, oh, well, I got done early, right? You're going to have 5 hours to take this test. Most of you are not going to need anywhere close to that. But again, just set your schedule for 5 hours. And I'm going to take 145 questions and then I'm going to move on with my life, right? Just set yourself up for that. Go in there as prepared as you can be because we're going to do this one and done, right? So that's a good tip for you guys. Any questions about the exam or exam day or anything like that, like logistical?
Hi, my name is Frankie Cook. I'm actually in class with McKenna at Ursuline, and we graduate in December, like she said.
Awesome.
I have a question. Is it possible for it to turn off after 75 questions and you fail? Like, can you get so many wrong that they just turn it off?
It is possible. It's very rare, but it is possible. Okay. So, and I know that's everybody's fear and worry. I'm just going to challenge you to do everything you can to prepare and then go in there expecting to take more than that. And that's one of the reasons, honestly, that we say every question you get served up after 75, that is a good thing, right? That's also why Courtney's friends left there crying, because you don't feel like you pass even when you pass. And it's because they're in the high level judgment questions. These are clinical judgment calls so often, and they're going to put you in a bind, put you in a situation where you'd really like to do all 4 of those options, right? Priority, which would you do? You want to do all 4. They're all reasonable things. And if you were at the bedside, you would do all those, right? You would do this, and this person helping you would do this. This is one reason you have to get in the NCLEX mindset, because it's a little different than the clinical and the real world, right? It just is. Because another thing that's different, and this is a key strategy for you guys taking NCLEX before next gen, which is all of you through 2023, is that they're going to give you the least amount of information in the stem of the question that they can give you in order to have enough to answer the question. So what does that mean? That means that you're going to not have all the information you would like to have, right? But it also means if they provide information in the stem of a question, like let's say a lab value, that means that that is really important in answering the question, or they wouldn't include it. Does that make sense? So it should give you a tip. They don't give extraneous information. They may not tell you what the vital signs are, when the surgery was, right? They just give you, this is what's going on right now. What would a safe nurse do to intervene in this situation? Your job is to think safety, think what would a safe nurse do right now? If they could only do one thing, what one thing would they do? Because again, often it's going to be that more than one answer is reasonable. Those are the kinds of scenarios we're going to cover in the review as well. So we're going over material. So it's not just a content review. I don't want anybody to hear that. We review content, but we're giving you NCLEX strategy all the way through the review so that you go in there feeling prepared. Does that make sense? So let's don't even think negative scenarios. I want you all set on mindset of positivity, but I want you to go in there prepared, right? Because it's a tough test and it's important, but just like anything else, prepare yourself. And like somebody said earlier, I know it can be confusing because there are so many resources out there. I promise you, if you decide to take Hurst Review, we're going to give you what you need. Just finish the program, follow the checklist, super simple. And I am here whole step of the way for you to call or ask any questions that you need. And we have, of course, the whole support team at our office. So you can get us on the phone if you need us, I promise. Any other questions or anything? I know we may have gone a little bit over, we're a little bit over 30 minutes, so I want to respect your time, but also answer any of your questions. Do not overthink it. Oh my gosh, I love that. Don't go down the rabbit holes of what if, thank you for saying that, because especially, this is all nursing students, but especially accelerated. Do I have any overthinkers in my accelerated groups, right? I was one of those undergrad BSN traditional overthinker people. You can just start your mind going in a million different directions and get confused. This is why we want you to know what's in this book so well that you can teach it to somebody almost. I mean, it's not huge, but you need to know it so that when that question pops up on the screen about, I don't know, it's a glucocorticoid question, okay? You know what should pop into your mind immediately? The 4 major actions of glucocorticoids. And you know those just like this. So there's a certain amount of information they can't change your mind about. You know it's 100% true. So however they ask the question, you're firm in your content, just is a different scenario, right? So you don't want to be sitting there if a question pops up, searching your mind for, oh gosh, what does that mean? Or what is the answer? You want the knowledge to pop into your head, then use those precious seconds to think, how do I apply this to that client on the screen in front of me to keep them safe? Not be a killer nurse, right? We say that, but we're serious. Like, what's the safety thing to do here? So that's what we're going to work through all the way in the review. Keep your client safe. The only client you have is the one on the screen in front of you. I know you've heard this in school, right? The NCLEX hospital is perfect, so you can't think, oh, well, I don't have a this and I don't have a that, so I couldn't do. Here's another thing. This is why I say wait till sort of later in the program to take NCLEX prep courses specifically, with the exception of Next Gen, which we're not talking about. But it's because you have to learn the rules in nursing school, and then on NCLEX be flexible enough that you aren't rigid and that you can take care of people. Example, what did we learn about calling the provider? By the way, they're providers or healthcare practitioners, primary healthcare practitioners. They don't use the word doctor on there. So if I've said doctor, it's just because I'm an old nurse. They don't say patient either. It's all client and healthcare provider. We do not call a healthcare provider without the vital signs, right? We learned that, didn't we? Very early on in nursing school, you have to have your set of information. But, okay, please don't do that in real life. That's 100% valid. We're not contradicting any rules on NCLEX, but what if NCLEX asked, they gave you a scenario and one of the options was call the healthcare provider, and they didn't give you anything that would help your client in any of the other 3 options, and the stem of the question doesn't have the vital signs? Do you see what I'm saying? You don't need to get bent up into rules so much that you don't take care of people. Because if the only option there that helps your client is to call the provider, you call the provider. You can't go in your mind, well, I can't call them because I don't have the vital signs, right? So that's the kind of way to think NCLEX, and we're going to give you a lot of those examples. And listen, we have testimonials almost weekly where students will email us and say, what you told us in the review was exactly what I saw on NCLEX. We have students from other countries that take Hurst and come in and take it. We have students that's been 15 years since nursing school. They take Hurst and pass. So if we can help those students, we have what it takes to help you guys, because you're all going to be fresh out of nursing school. It's just, you have to work the program like anything else, invest in it. And I'm so excited to be covering Ohio. I just started August 1st. So I would love to get to meet all of you and come to your school. So if your faculty is open to that, I would love to come and talk to your class if you would like, specifically about your class, or closer to your graduation. Please keep my number and keep me in mind. And especially Ursuline, I would love to know if there's a faculty that you would recommend that I reach out to, because I don't have anyone there yet. Of course, I can check the website and just reach out to somebody, but I would love to have a person to talk to let them know that I talked to you, so there's never any conflict. And we always want to work with faculty. But I'm here to help you guys. I have confidence in you. I wish you the very best. And I think you're going to do great. I'm going to stay around for any questions and that you have in the chat, or you can ask, or whatever you need to do.
I think faculty for Ursuline, we have our dean, who is Patricia Sharpnack.
Okay.
I think she would probably be a good resource to reach out to. I can put her contact information in the chat box. Or there's also Bonnie Fellows, and she's like an advisor, and she also is an instructor. She teaches some of the courses as well.
Did you say Fellows?
Yeah, Bonnie Fellows. I'm just pulling up there.
Is it Dr. or Miss Fellows?
She's Miss Fellows.
Okay, got it. I can probably find their emails on the website too, because I did see your dean's name. Sometimes there's one person who works with the 4th semester students or last semester, and that's sometimes who you talk to. But I definitely will reach out to her and tell her that I got to meet some of you virtually. So excited y'all joined. Was this helpful? I would love to know if it was helpful, or if is there anything else you wish we had covered or anything?
Oh no, it was helpful to me because that's one thing I was wondering about. Just because since I'm in an accelerated program and I'll technically be doing NCLEX prep already next year, even though I'm already starting this year. I just didn't know how soon you should start to prepare. But,
and a lot of programs will have you doing questions throughout. And of course, you may have a program in your school. Oh yes, discount code. I'll type that in here.
Like
and
they
again,
have us now doing through our classes, we have ATI.
Yes.
So they gave us like a box of books. And so we have like that. And then we also have the modules that we have to complete online.
Yes, do all of that. And you probably have practice questions. So just do all of that. Take advantage of every resource that you have. And then again, when it gets closer, if you want to take an extra course, Hurst works really well with any of those. We're not affiliated with any of those companies, but students can take both because we're very different in our approaches to things, and a lot of schools will use both of those or a number of other programs. Okay. So yeah, just work on what your school tells you until you get closer to NCLEX, and then reach out to us. So past NCLEX Ohio OH is the $50 discount code. That's 50 off of the in-stream or the live. It doesn't work on the online strictly. So in-stream or live, and I will do the drawing from everybody who got registered and email you guys, and I'll let Marissa know. I don't know if she wants to put it on the website or not, but again, if I can be of any help to anybody, oh, thank you for those emails. I would be happy to answer any questions. I'm a nurse. I'm rooting for you guys. We want you all to pass because we need you, and I'm so grateful for you. And you're about to enter the best profession on earth, and some of y'all already know that. You're in nursing. So great decision. I'm going to write down these emails, and any other questions y'all are welcome to ask. And I'm saying it wrong. It's Ursuline. How do you say it?
Ursuline.
Ursuline, not Ursuline. Okay, Ursuline. Okay, perfect. I've got it. Do you mind if I use your name, Zane, and just say that a couple of y'all were on?
Yeah, my name is pronounced Janae.
Oh, I'm sorry. I'm saying your name wrong. Well,
that's okay.
Janae, I love that.
Thank you.
It. Thank you for correcting me. Thank you, guys. I hope it was helpful.
Yes, thank you.
Thank you so much. Y'all have a great day and a great weekend.
You too.
Any advice or resources for students wanting to take their NCLEX in a different state other than they're in school? Honestly, the advice is the same. Of course, you need to know what the NCLEX protocols and procedures are to get licensed in that state. Every state has different rules and regs, but it's the same test, exactly the same test across the United States, across Canada. So whatever you took your nursing program, same NCLEX. So Hurst Review would help you on any of that. And we also have a PN review if you guys have friends or programs with, but we're talking specifically RN, but same thing, it's just a little different, a little shorter review. You're very welcome, Genevieve. Where do you go to school?
Hi, I also go to Ursuline in Ohio.
Okay, where are you planning on moving or testing?
Potentially, so my family is from Oregon, so potentially Oregon.
Beautiful state. What part of Oregon?
Bend or Portland.
Yes. I know my son and daughter-in-law and my little grandbaby now live in Pullman, Washington, which is just north of Pullman, Colfax. So yeah, on the eastern side. So, and he went to Oregon State for an exchange program when he was at college at Mississippi State, and we got to go and visit. It's a beautiful country.
Very cool. Yeah, I went to OSU too.
Good. Well, good luck to you. Thank you for all the questions. And Marissa, is there anything else that you wanted covered for the recording? Jennifer, any questions? Anybody?
I think we're good on this end. Once everyone has done with their questions, I'll stop the recording and I will give it to our PR director so that it can be posted on the website.
Awesome. Well, thank you for this opportunity. I've so enjoyed it. Like I said, I wish we could be in person, but maybe next year. Not all of you all be there, but some of you might.
Thanks so much.
You're very welcome.